Good evening. We are having one of the most prominent doctors of BM Birla. We are having Senior Consultant CTVS BM Birla, Dr. Soumya Guha. So, being a questionnaire and information session, we would have some questions from a patient perspective. Heart surgery and cardiac surgery in Kolkata, has there been an evolution?
So, Devdas, thank you for the introduction. Yes, of course. I think since the time heart surgery began in Kolkata and where we are right now, there has definitely been an evolution. The surgeries are safer, they are quicker, and you have got more and more people who have been trained from abroad and from good centers all across India who are now here offering the services. We also have minimal access surgeries now and robotic assisted surgeries. So I would say yes, surgery in Kolkata definitely has come a long way.
Right. We see a lot of people still insist to visit Bangalore, Chennai, or Hyderabad for heart interventions. Why do you think so?
This is a peculiar conundrum which I have seen since I have returned to Kolkata from the United Kingdom. What I have seen here is that people tend to trust or put their faith more in the southern institutes rather than in the home institute. And of course, I have tried to analyze through patient interactions as to why does this happen. Somewhere there is a bit of a trust issue. People find that when they go to the south, the way the doctors interact with them is perhaps different and more suitable to their tastes. They do end up paying a higher amount when they go to the south because there is the aspect of the journey, aspect of stay there, and of course medical services in the south are not more economical compared to Kolkata. It is not so. But despite this, they trust the system in the south more than they do here, which is peculiar. Because I personally believe that in Kolkata, state-of-the-art treatment is actually available. Somewhere along the line, I think the people of Kolkata, some of them who do migrate south, there has been an attrition in the trust. And if we are able to convince them that the medical system and the surgical system in Kolkata is as trustworthy, as stable, as updated as the system in the south, I think we would be able to encourage these patients from saving their time and their economic resources by seeking treatment in Kolkata, because it is much easier to follow up with your care here than when you go to the south. So that trust has to be brought back, that stability and that faith that they are in good hands, that the safety net is there to protect their interests has to be brought back.
Okay, adding on to this, you told about trust and faith. Is there any point where Kolkata steps back?
So Kolkata cardiac surgery now, compared to the institutes in the south, probably it has picked up at a later date, and its evolution has been perhaps a little delayed compared to institutes in the south. So there was a time when people did used to go to outside Kolkata for their treatment. But now the kind of doctors you have in Kolkata, kind of surgeons you have, the kind of facilities you have in the premier institutes, I do not feel they are in any way subpar to the institutes in the south. Most of them are similar, and there are very few institutes in Kolkata which are actually at the level of Delhi, Bangalore, Chennai as well in terms of patient safety, nursing care, surgical doctor expertise, and patient satisfaction. So maybe at one point Kolkata was behind, but right now, having been trained in Delhi, having been trained in Chennai, having stayed in Kolkata, having been trained in the United Kingdom, well, at least I can say that here in BM Birla, we offer services, or at least my unit offers services which are at par with those institutes which are considered to be one of the finest in India or in the world. And we constantly strive to improve further and further so that our services can get better, so that patients get access to cutting edge surgical technology in Kolkata itself.
Right. How do you plan to convince those patients to get treated in Kolkata?
What I usually tell my patients is the burden of traveling and getting the cutting edge surgical technology, rather than the patients having to take that burden upon themselves and them having to travel outside, you have got people like us who have been trained in the premier institutes in the country, who have trained abroad. So we are actually traveling around and learning the most cutting edge techniques, the greatest surgical advancements, and we are trying to bring these to you in Kolkata so that you do not have to travel. We are traveling for you. We are taking that burden upon ourselves, and we are coming back, and then we are trying to upgrade this existing system here to the level of the premier institutes in Delhi, Chennai, Bangalore, Hyderabad, and even in the United Kingdom or the Americas. And we are trying to give you these services or these surgical advancements right here in Kolkata so that you don't have to travel, so that you can stay with your loved ones while you're getting treated. You can follow up here and there can be continuity of care. Most of the Western world, why do they thrive? Because they are able to maintain this continuity of care. And I think loco-regional continuity of care is very important. Interstate continuity of care, somewhere it is not a sustainable program. And if you are able to follow up with a surgeon loco-regionally who has treated you, obviously that is better than having to follow the doctor loco-regionally out of desperation because the person treating you is actually miles and miles away. So this is what I really try to convince my patients, that don't be afraid. Situation in Kolkata is quite good. Premier hospitals like BM Birla, well, they do offer you cutting edge technology. They offer you one of the best nursing cares available. You have people like us who go around the world. Wherever there is an advancement, we go, we see, we study, we get trained under the greats. We keep on developing our practice. And then we bring these practices back to you. We give you the latest that there is in cardiac surgery.
Okay, so the last question, sir. If it is Kolkata, then why it is BM Birla? And if it is BM Birla, especially why Dr. Soumya Guha?
That is a very interesting question, and I think I need to navigate this question properly. So let me put it this way: why BM Birla first? BM Birla is a very old institute. I think it was a vision. It was a really visionary move that to have an institute in Kolkata dedicated only to the heart. So in that era when BM Birla came up, how many hospitals would have the courage or the vision to dedicate themselves to a single specialty? So because BM Birla had this clear vision that heart was the one area where they wanted to focus, BM Birla has always been able to maintain a certain standard and a technological advancement when compared to other specialty hospitals institutes, because in those hospitals the focus is on various departments, whereas here the focus is simply on a single organ, that is the heart. So if there is any academic, technological, medicinal or surgical advancement or evolution anywhere in the world, BM Birla tries to make sure that that can be made available to you. So when it comes to matters of the heart, I think BM Birla does have an edge over other hospitals because of its focus, because of the number of years behind it, and because of the absolute professionalism that is displayed by every member of the hospital, whether they are medical or non-medical. And of course, this is one hospital where I have seen patient always comes first. And this hospital always tries to get you doctors who have trained nationally and internationally so that they can offer you the latest that there is. The second part, why Dr. Soumya Guha? So rather than say why Dr. Soumya Guha, why doctors like Soumya Guha, let me answer that. Now, why doctors like me? So I'm a person who's gone to Chennai. I've trained in Chennai. I've gone to Delhi. I've trained in Delhi. I've trained in government institutes. I've trained in private institutes. I've also gone to the UK, trained there, worked there, done fellowships there. Now, why do people like us, doctors like us, work so hard? Why do we not stay in one place at home and enjoy proper work-life balance? Why travel so much? Why go to so many places? Why do we do this? Because at the end of the day, I try to offer a care to you as if you would be my own relative. So I always think that if my own relative was to get a particular heart intervention, heart surgery done, can that person come to me and ask for it? And can I do justice? Can I offer him or her the most advanced treatment possible? Can I do it marrying technology with economy? Can I do it economically? At the end of the day, can I proudly offer my patient and tell him that, yes, look, you have come to me, you have put your faith in me, and I will do complete justice to your faith. Why? Because I have trained with the greats, which I have trained in various specialities, I have trained in various techniques, which is why I can bring them back here. And because my initial training has been in India, so it is not that I do not understand the needs of the Indian patients. I do not understand the needs of the patients of Kolkata. I do. But I also understand why certain centers are technologically superior or why they have been able to progress more than others. So when I come to an institute like BM Birla, which believes in surgical evolution, which believes that the best treatment and the latest treatment should be made available to you, and when I'm able to get this vast experience of working in so many different premier institutes, having this plethora of so many different advanced surgical techniques, and when I can bring this experience to you, and when I can bring this experience to you in a center which is reputed, which is safe like BM Birla, I think this combination is beautiful. So when you come to a surgeon like me who's trained abroad, who's trained in the national institutes, who has this experience behind him, and when you come to a surgeon like me in an institute as old as BM Birla, as safe and as renowned as BM Birla, the safety net for you is guaranteed. And that is where I think most patients will feel comfortable, because at the end of the day, heart surgery is a big operation. We have been given one heart. It is a source of all our lives. Therefore, apprehension regarding heart surgery is quite justifiable. And when you know at the back of the mind that I am going to this hospital which is renowned for heart surgery, I'm going to this particular doctor who has trained in so many places, who has been certified by so many institutes both in the country and abroad. So I know that I am going to not only get the latest treatment, but I'm also going to be in a really safe system where I can put all my apprehension, my fears into the hands of my treating surgeon and his team. So I think this is why I can safely say that yes, people should come here and they should get trained by people like us who have been trained nationally and internationally. We have worked hard to make our services available to you so that you don't have to travel outside to get these services.
Right. This was a nice session, sir. We would like to meet you again in our next podcast. A nice session, sir.
Thank you so much.